Hi everyone. I've had a few questions about how to do the checks and the rights, and so I thought I'd kind of do a little demo here for you so you had maybe a better idea. And so I'm going to kind of go through kind of the expectations and how to do the checks and the rights for your medication lab eval. So the first thing is first is that you're going to be wearing your uniform, okay? And so as well as you're going to show your ID, right? So your student ID, the front and the back of your ID, okay? Next, I'm going to show you the pieces of documentation that I have. So I have my care plan, okay? And I also have my MAR for Ethel Parker. And I also have a scrap piece of paper, okay? And there's nothing written on it right now. Okay, so the first thing is first is I'm going to hand hygiene. So right now, I'm just gonna review the care plan. So the care plan says Ethel Parker. So on here it says EP, so these are her initials. Her birth date is August 2, 1925. Some other things on the care plan I'd review is her allergies. So she's allergic to peanuts and penicillin. Her medical history looks like she has hypertension, diabetes, neuropathy, total left hip replacement, and congestive heart failure. I'm also interested to know the level of assistance of medication. So on her care plan, it says directly assist with medications and offer plenty of fluids with medication. So takes pills whole. So it doesn't have any indication that she needs her pills crushed or split in half or mixed with applesauce or pudding. I've also noticed on the care plan that it also says sweeten cream sparingly to the top of the right hand twice a day. And it says to moisturize the skin. So now that I reviewed the care plan, I'm just gonna put this aside. And so now I'm gonna go through the three safety checks. So the first safety check is done by the nurse, and the nurse will then verify the prescription with the doctor's order. So in the second check, this is done by the healthcare aide. So I'm gonna go ahead and do my second check. So I'm just gonna go ahead and maybe hand sanitize my hands. Okay, and I'm going to be doing the 8 o'clock meds. Okay, and so I do have my blister pack for digoxin here with the medication label. And I also have the sweetening cream as well with the medication label on there as well. So I'm gonna use my scrap paper. I can then write the 9 rights. So the right client, the right medication, the right dose, the right day, the right time, okay, the right expiry, the right reason, okay, and the right route, and the right documentation. So I'm just gonna use this as reference if needed. So I'm just gonna put that there for now. So first thing is first is I'm gonna go through the right client. So this is the second check. So I'm going to be outside the room, so probably in the med room doing the second check, okay? So the right client is Ethel Parker, hospital number 11234567 and date of birth August 2, 1925. So I'm gonna be comparing the MAR with the medication label, okay? So the right client, Ethel Parker, hospital number 11234567 date of birth August 2, 1925. Okay, so that's the right client. Okay, then it's the right medication. So on here it says digoxin. On the medication label, it also says digoxin. The right dose, 0.125 milligrams, 1 tab, 0.125 milligrams, 1 tab. Okay, the route says by mouth, and on the medication label, it also says by mouth. The right day, so today is February the 19th. Okay, and I'm going to be giving it on Saturday, which is today, It does say daily, so I'm going to give it at 8 o'clock, which is the right time. Okay, and then there's some instructions here that says hold if pulse is less than 60 beats per minute. And it also says here hold if pulse is less than 60 beats per minute. I'm then going to check the right expiry date. So on here it says December 1, 2025. So it looks like it's good. And I have the right documentation. Okay. So then I'm gonna check my other medication for 8 o'clock. So this is Sween Cream. So the right client, so I'm gonna go through the 9 rights for Sween Cream as well. So the right client or the right name, so Ethel Parker, hospital number 1123456778, date of birth August 2, 1925. The name on here is Ethel Parker, hospital number 1123456778, and August 2, 1925. So the MAR matches the medication label. So I'm going to look at the right medication. So the right medication is Sween Cream. Sween Cream. The right dose, it says apply sparingly, apply sparingly. So that means a small amount. The right route. So the MAR says to the top of the right hand. And it also says on the label, the top of the right hand. The right day. So it says here, today's February 19th, so Saturday. I'm going to give it today, Saturday. The right time, it says 2 times a day, 2 times a day, at 8 o'clock and 2000, but I'm going to be giving it at 8 o'clock. The right expiry date is June 2023, so it looks like it's still good to go, okay? And then the right documentation. One thing that I also need to mention as well is the right reason. So the right reason for Sween Cream is moisturizer, and the right reason for digoxin is because, according to the care plan, she has congestive heart failure, so it's for her heart. Okay, so that's the first part of the safety check. For the second safety check, is verifying the MAR with the medication label. Now I'm going to do this for a second time in the second safety check. So I'll start with digoxin. So right client, Ethel Parker, hospital number 1123456778, date of birth August 2, 1925, as well as here it says Ethel Parker 1123456778, date of birth August 2, 1925. Okay, so that's the right client. The right medication, digoxin. The right dose, 0.125 milligrams, 1 tab. 0.125 milligrams, 1 tab. The right route says by mouth, The right reason, okay, so the right reason for this would be the heart, for congestive heart failure. The right expiry date, so June 2023. Some special instruction says hold of pulse is less than 60 beats per minute. And it says here as well, hold of pulse is less than 60 beats per minute. Okay, the right day, Saturday, February 19th, and I'm going to be giving it at 8 o'clock. Okay, and I have the right documentation. So at this point now, I can go ahead and prepare the medication. So I'm going to label my cup. So I'll put digoxin, and I'm also going to put the special instructions to hold if pulse is less than 60. Okay. At this time as well, I'm going to check to make sure the integrity of the medication, to make sure it's not crushed, it's still in its form, it's not discolored, it looks good. Okay, and I'm going to put it directly in my cup here. Okay, and then this is also time I can also check the allergies again, so peanuts and penicillin. Okay, so I'm going to go ahead and put that in my tray that I have. Okay, now I'm going to do Sween Cream. So I'm still in my second check. So right client, so Ethel Parker, 11234678, date of birth August 2, 1925. Right client, Ethel Parker, hospital number 1123456778, and the date of birth August 2, 1925. The right medication, so Sween Cream, the right dose, apply sparingly, apply sparingly. The right route, so it says top to top of the right hand, to top of right hand. Okay, is the right root. The right day, so today is February 19th, so Saturday, I'm going to be giving it today on Saturday. The right time, so here it says 2 times a day at 8 o'clock and 2000. I'm going to give it at 8 o'clock. The right reason for this is a moisturizer, and then the expiry date is June 2023, so it's still good, and I have the right documentation. Okay, so now I'm going to prepare this so I can get some gauze. I'm going to take about 1 to 2 millimeters from the top of this. Okay, and this is just to get off the excess or not to contaminate the medication that we'll be using after. So you're going to get a little bit of that. Okay, and then close this back. I'm going to go ahead and bring this into the room. Okay, and I'm going to go ahead and bring my other supplies that I need. Okay, so I'm gonna need like gauze. I might need a tongue depressor, and I'm gonna need a set of gloves as well. I'm probably gonna bring a cup of water. Okay, and my care plan and my Myrah and my pen. So now that I've got everything, I'm gonna go into the room and do the third check. Okay, so I'm gonna go into the room, I'm gonna do the third check. Okay, I'm gonna knock, knock, knock. I'm going to hand hygiene, and I'm going to introduce myself. So I'm gonna say, good morning, Ethel Parker. I'm here to assist you with medications. May I assist you with your meds? And she says, that's okay. Okay, I'm then going to make sure I have the right client. So I'm gonna compare my Myrah with her ID band. Okay, so it says Ethel Parker, hospital number 112345678, 112345678, date of birth August 2, 1925, date of birth August 2, 1925. And so I've identified it's the right client. Okay, I'm also going to raise the bed, right, provide privacy, check the brakes, okay, and ensure that she's in a comfortable position. Okay, so for taking oral medications, I'm gonna make sure she is sitting upright. Okay, so I could raise the head of the bed. Okay, so at this point now, I would like to give her some water. Okay, and I'm just going to observe to see if she is swallowing the water okay, or if she's having any difficulty. So it looks like she's been able to swallow that water. So I'm gonna go ahead and give her the digoxin. But first it says hold if pulse is less than 60. So I'm going to check her radial pulse for a minute. Okay, and it's about 84. So it looks like it's okay to give. Okay, so I'm gonna give her, put this in her hand, right, and she's going to put that in her mouth. Okay, then I'm going to give her plenty of water because it says in the care plan that she needs plenty of fluids. Okay, and then I'm going to observe in her mouth to see if she swallowed the medications. So I can get her to talk to me, I can get her to open her mouth, or I can look underneath her tongue. Okay, so it looks like she swallowed that. So we're still going to get her to sit upright. I'm going to then sign the Myrah at this point for digoxin for that date. So I'm going to initial at February 19th at 8 o'clock. And I'm going to put the pulse where it says pulse. Okay, so next is the swing cream. So I'm going to put my gloves on. So at this point, I can kind of see which hand it is. So it says top of the right hand. I'm gonna put my gloves on. Okay, and I'm going to grab her swing cream. Okay, I'm gonna put a little bit on my gloved hand here. Okay, and then I'm gonna apply sparingly. Okay, so top of the right hand is right here. So I'm gonna do long strokes. I'm also gonna observe the hand for any redness or any open areas. Okay, because that's something I might want to report. And you're gonna apply the Sween cream sparingly in long strokes going in the direction that the hair grows. Okay. So once I'm done that, I'm still gonna make sure she's sitting upright. I'm gonna remove my gloves. Okay, and then I'm going to sign for the Sween cream at 8 o'clock. Okay. I'm also gonna sign here where it says HCA signature, and as well for the initials at the bottom of the bar there. Okay, next I'm going to make sure that she sits in this position upright for at least 30 minutes. I want to maybe provide some mouth care for her, and then I'd also want to see if she's had any difficulty swallowing, if she's been coughing, if she's been having any pain. That's something I might want to report. Okay, so now that she's okay, right, I can give her more fluids, right, if needed. Okay, I am then gonna give her call bell. Okay, I'm gonna put the bed down to the lowest height, and I'm gonna check the brakes. I'm gonna remove the privacy, right, and make sure she is comfortable. I'd probably get rid of all of my stuff here, right, so in its appropriate place. So either it's the garbage or the biohazard container, I would make sure I clean up before leaving the room. Okay, and then I'd wash my hands. Okay, and then I would report any of those observations that I seen that I mentioned earlier, and then I would just double check my documentation, and that would be the demo for assisting with medications. Thank you.